Acessa is sometimes confused with uterine artery embolization, or it's sometimes called uterine fibroid embolization, which is a misnomer, meaning it's not a correct name. Embolization involves injecting permanent particles into the circulation of the uterus. And those particles go into the circulation of the uterus, occlude blood vessels when the blood vessels get small, and therefore everything downstream from the occlusion now receives less blood flow and oxygen and nutrition. The occlusion occurs everywhere within the uterine circulation, not just in vessels that go to fibroids. So uterine artery embolization, because the embolization is occurring in the uterine arteries, is really the correct name. And it's a global procedure that treats the entire uterus, not specifically the fibroids. And it's important to understand that normal tissue is being damaged most definitively by this procedure. In contrast, Acessa treats just the fibroid, other than for a needle track. A small needle is placed through the muscle and then into each fibroid. Energy is run into that fibroid, destroys that fibroid, and that destruction is limited to just the fibroid. Then the needle is withdrawn. So these are two very different procedures with two very different outcomes. And each one can be appropriate depending upon the situation and the patient's desire.